Hi everybody, welcome to the first episode of my Moyamoya Diaries. My name is Katie, I am 28 years old, and I was diagnosed with Moyamoya in November of this year. I wanted to create this short series of video diaries in case anybody else out there is going through a similar situation. If you're not familiar with Moyamoya, it is a rare disease of the blood vessels in the brain. It causes branches of the carotid artery to narrow slowly over time, which effectively cuts off good blood flow to parts of the brain and puts the patient at a greater risk for strokes and mini strokes, or TIAs, transient ischemic attacks. For me, what I can remember is that my symptoms really started when I was about 24. I started getting just really random numbness and tingling in my right hand. It would be like the tip of my finger, or two or three of my fingers would get numb, and then it would go away after a few seconds, maybe a minute tops. I would also get numbness on the right side of my face. My lip would go numb, the tip of my tongue would go numb, my nostril would go numb, and then again it would only hang around for a few seconds and it would go away. So I told my general practitioner doctor about this when I saw him later on in the year, and I guess a year and a half or 2 years before I got an MRI, because I'd been getting migraines, and it didn't show anything, but my GP was like, why don't we go ahead and get you another MRI of your brain just to kind of see if anything's going on, because it's not really normal to have those symptoms you're having. So I had the MRI, and it actually showed white matter lesions on the left side of my brain. They were non-specific white matter lesions, so they weren't exactly sure what was causing them. But given what they looked like and my age and my symptoms and the fact that I was a female, I was initially diagnosed with multiple sclerosis. I was being treated for multiple sclerosis. I saw a neurologist who was kind of specializing in multiple sclerosis at the time. And if you have MS, you get an MRI every year or every 6 months, depending on your disease. And so this year in June, I had my usual MRI of my brain and C-spine, and this time it showed more lesions, but only on the left side of my brain again. And my neurologist said, Katie, this isn't a normal course for MS. Usually it's non-discriminatory. It'll go to either side of the brain, spinal cord, et cetera, et cetera. So he said we should probably get some more imaging studies, different imaging studies, to see if there's anything else going on, an underlying cause for these lesions that isn't MS. So I had an MRA done first. That was my first test. And an MRA is like an MRI, but it shows just the blood vessels. So I had the MRA done, and it showed significant or severe, I can't remember what word my neurologist used, blood vessel abnormalities. So I freaked out, needless to say, when he called me to tell me this, because I thought, oh my God, do I have an aneurysm? Do I have some kind of malformation of the blood vessels? What's going on here? I'm crying to my husband. And, my neurologist was very supportive and a nice guy. He said, well, let's have another test done, a different test, and a CTA, which is a CAT scan that looks at the blood vessels, and we'll see if it shows the same thing. Maybe it was just an error in the testing. So I had the CTA done this summer, and it showed, unfortunately, the same abnormalities. They couldn't quite pinpoint what the abnormalities were, but there was something going on. So the next step in this process, after having the MRA and the CTA, was a cerebral angiogram, which is not fun. Let me put that out there first of all. It involves having a catheter threaded up through your femoral artery. They put it in your groin, first, and then they thread it up through your arterial system to your neck, and then they shoot contrast material up into your brain from different vessels in your neck. And so it burned. The contrast material really burned. It was especially painful on the left side of my face and the left side of my head. But when I was recovering from the angiogram, because you have to like lay out for several hours after having an angio, the interventional neuroradiologist, as they are called, who ran the test, came in to talk to me, and she said, she was a really nice lady, but she said, we're seeing some pretty significant narrowing of some blood vessels in your brain on the left side. And just from looking at your angio preemptively, I'm gonna say I think you have Moyamoya. And I'd never heard of Moyamoya, let's be honest with each other. And my husband and I were like making fun of the name. We're like, oh, it sounds like a kind of fish, you know, mahi mahi moya moya, or a Billy Idol song, moni moni moya moya. We were laughing. But as it turns out, when my stroke specialist neurologist, different guy from the MS guy, when he looked at the angio, he said, yeah, this girl has moya moya, and I think it's pretty clear. So that was kind of freaky, being diagnosed. First, it was like, you don't have MS, you have Moyamoya. And then it's like, well, what the crap is Moyamoya? So I had 2 more tests after being officially diagnosed with Moyamoya. I had a perfusion weighted MRI, which is kind of cool. Again, doesn't take as long as a regular MRI, but it kind of shows how well blood is flowing and getting to the tissues in your brain. And then I had a transcranial Doppler, which involves one of those, Doppler sticks being put on different parts of your head to, I guess, test the velocity, how fast the blood is moving through your different arteries in your brain. That was cool. Not really. So I've had all these tests done, and the be all end all of it is, unfortunately, the only way to treat Moyamoya is to have cerebral revascularization surgery, which sounds really scary, and it is scary. But my neurologist, or excuse me, my neurosurgeon, because I've met with all these different people throughout this whole journey. My neurosurgeon, really, really nice man. He said, Katie, to be honest, on a scale of 1 to 10, this is like a 3 in terms of risk and complications. So that makes me feel good. But I'm still kind of scared. My surgery has been scheduled for January 10th. Today is December 28th. So it's looming in my future. So I plan to make a couple more episodes for my Moyamoya Diaries, kind of going through, maybe right before my surgery, how am I feeling? And then right after the surgery, when I'm not as goofed up on drugs anymore, how am I doing right after the surgery, and so on and so forth. So if you're interested in this subject, or you're going through a similar situation, keep watching, and I'll see you guys later. Thanks. Bye.